A sexually active 37-year-old female, the Tzanck smear, what is it showing? Multinucleated giant cell, which is classical of herpes simplex virus. Nevirapin, what group of drug does it belong to? It is a non-nucleoside reverse transcriptase inhibitor, and it inhibits the HIV by binding to the reverse transcriptase is what you need to basically remember. So, you should know different antiretroviral drugs, what is their mechanism of action. Invariably, there will be a question that will be coming in the NEET PG. This Thursday or Friday, we will be releasing the new version of the U Medico. Please download. There are 600 topics. Diagnostic tests in each topic are made available. You can fight with one of your friends. You can quiz yourself. There will be 10 question quizzes, and you will get a particular score, a score of your level. And you should see that all 600 quizzes, you get to level 5. Until then, you keep playing. Every time you get a mood, you finish reading. Before reading, you play. After reading, you play. You see how your level has improved. And you will get coins if you happen to win the quiz. And you lose coins when you, to the other person, if you lose the quiz. But spardhaya vardhate vidya. Only when you are striving to win on someone else with competitive edge, then only comes the shine in preparation. So that is the reason we want you to download the U Medico. The new version is coming on this Friday, and we will give you 600 most high yield topics among the 19 subjects totally. All 600 topics you should reach level 5. Then any entrance you go, you will win. So that is the reason reading is not the secret of winning. It is quickly to know among the high yield topics how I am good, how many I am good naturally, how many I need to improve. After reading, did I improve or not? So that all can happen only when you are quizzing. You can call your Facebook friends who also are on the U Medico app. You can invite them for a fight, and you both can concurrently fight, and then you can win in the game. So today, gamification of learning is all that we are doing with a lot of artificial intelligence in the background. So I hope you will give me a feedback on how you are motivated to read, to improve yourself, touch all the 600 topics and go to the exam confidently. I am waiting for your feedback. So this Friday you will find the new version of the U Medico app. 35-year-old woman delivers a newborn who develops meningitis. Typically, the virulence of the organism is related to a bacterial component that interferes with the which important phagocytic function. So typically, it is the ingestion against which the bacterial constituent is interfering with the ingestion by the macrophage. That's how it is able to show high virulence, is what you need to appreciate. 33-year-old, typically she is having malaria and treated with a full course of chloroquine. But later on, after coming to Mumbai, she is once more having malaria. Peripheral blood smear is showing two forms in the trophozoites. So what is this typical of? This is very typical of Plasmodium vivax, is what you need to basically remember. 3 weeks after traveling to California to study the desert flowers, a non-resident Indian, he develops fever, chest pain and muscle soreness. And you can see the typical painful lesions. So what is it most likely to be? Coccidioidomycosis, which is also called desert fever, is what desert valley fever is what you need to remember. At the banquet, the menu includes fried chicken. Within 2 hours, the people who went for that banquet fell ill, nausea, vomiting, abdominal pain and diarrhea. Whenever you are traveling, don't eat the things which are the products like cheese and other things. They are at a great risk of giving you a staphylococcus aureus food poisoning, whose incubation period is less than 6 hours is what you need to remember. A 35-year-old, X-ray of the chest is being shown where you are having a typical pneumonic pattern. Agglutinating antibodies are there in the cold agglutinating bodies. So cold agglutinating bodies plus pneumonia on the chest radiograph. What is this combination? The combination is typical of Mycoplasma pneumoniae is what you need to remember.